good day, and hello. Welcome back to the Dr. Coach Show. I am your host, Dr. Coach Daniel Pueblos, and today I have my good friend, licensed practitioner and certified mental performance consultant, my good friend, Dr. Erin Haugen. How are you doing today, Erin?
I am doing well, Danny. Thanks for having me.
Absolutely. I appreciate you coming on. I know you and I have been following each other and seeing each other's journeys, and both of us doing our thing in the fields of helping people, right?
Mm-hmm.
You bring a very unique perspective and approach to the field of mental health in general, because you have your practice, and also you work
Mm-hmm.
as a CNPC.
Mm-hmm.
So that's why I wanted to bring you on, because you're doing such a great work across the board, and I want to kind of share you with the listeners, so thank you again for coming on today.
Yeah, I appreciate it, Danny. I love my work, and I love interacting with all the wonderful humans I have the privilege to help. So I appreciate you and creating this space for a cool conversation.
Absolutely. So take me back. Okay. Take me
Mhm.
back to when you first started. Like, at what point did you know you wanted to be in this field? Like, I know, again, you kind of dabble in both.
Mhm.
But like, what was it that got you going and motivated to get into this field?
It's actually really interesting, Danny, because I took a very windy path, for lack of a better word, to get to where I am. I had always known that I wanted to be a mental health professional in some way, shape, or form. I actually, when I was younger, went to undergrad with the intention of being a psychiatrist, actually, so going to med school. And my first honors intro to psychology class, I was describing to my professor, who was a psychologist, what I wanted to do. And she was like, Erin, no, you actually want to be a psychologist. You don't want to go to med school. My grades in biology and chemistry also proved that that was accurate. Was not my jam. And so I was fortunate to kind of switch my path and go into graduate school. But I actually went to graduate school with the intention of being a researcher, actually. Didn't even know that sports psychology existed until much later in my, well, not much, well, probably much later in my career. So basically did a lot of work in graduate school, actually with pregnant and postpartum women who are experiencing anxiety disorders. So that's what all my research was, a lot of anxiety disorders research in graduate school. My internship and postdoc were focused on working with people with severe and persistent mental illness in community mental health center settings. And then it just so happened that the first job that I took out of college, which is actually the same job that I still have, and I've been out of college for quite a while now, was in a private practice that was actually housed in the same building as team physicians for a local university were housed in. And so I was an athlete in high school, still athletic, and in college was not a college athlete, but was still physically active. And basically the team physicians were referring athletes who were experiencing some difficulties, either mental health difficulties or injury rehabilitation difficulties. And because I was the athlete of the group, they had me meet with the athletes. And realized a couple of things pretty quickly. One was I absolutely loved working with the athlete population, loved their energy, loved their curiosity, loved their motivation. But the second part was I really realized that although I had the mental health treatment training, I was really missing that performance psychology training, which is just simply a key part to working with athletes, even if you're working with them for treating mental health difficulties. So I'd been licensed for maybe about 5 or 6 years, and I did some Googling and found the Association for Applied Sports Psychology, learned a little bit about my CMPC, found myself a mentor, and started on that path, 10 or so years ago. And then got my CMPC in 2014, and here we are. This is what I do now.
Awesome. I love it. And that's why I say, like, unique, you come from a unique journey, unique experience, because you have a history and experience in both the clinical setting and the performance psychology setting, whereas a lot of people, it's kind of either or, right?
Right.
So, like, what has been the key difference, like, from your perspective, like, that you've seen from the clinical? Because are you still doing both right now?
I'm doing primarily performance work, but I still do a little bit of clinical work. And then with college athletes, there's this interesting kind of overlap sometimes. Trying to tease those apart can be a little bit tricky sometimes, but predominantly performance.
Got it. So, like, making that transition, like, what are some, like, similarities or differences that you've seen and like just share that, with people who are listening who might not be too keen about like the key differences between like a clinical setting versus working with an athlete, for instance, on like performance psychology stuff.
Absolutely. So I actually supervise a lot of licensed mental health professionals who are looking to recertify or kind of respecialize in performance psychology, actually. So that's definitely a key thing that we're always talking about, because they're similar, we'll use cognitive behavioral techniques, ACT techniques, but the whole lens is really different from a kind of a mental illness treatment model versus a performance psychology model. And really kind of working to, I think with mental health treatment, essentially what we're trying to do is we're trying to help people navigate symptoms or decrease symptoms. Whereas with performance psychology, there might not be symptoms or things that we're trying to get rid of or anything like that. We're working from kind of an excellence model and just helping people improve and grow, and look for opportunities to continue to build on some of those skills in kind of a more positive psychology model. And so I think for a lot of people, when they're kind of making that shift, it's really easy to kind of look for like what needs to be fixed or what needs to be treated when we have that licensed mental health professional background. And sometimes there's things, right? Like sometimes there's performance anxiety and we work with that in performance settings. But a lot of times it's just really trying to optimize performance and grow and build and just continue to achieve and get better without necessarily trying to treat or get rid of anything, which is a real big shift. But then once we make it, it's like, oh, I can't unsee that, right? We just have that lens, then we view those things through. But in mentoring licensed mental health professionals and even that own journey for me, it took me a little bit to kind of really grasp, like, what does that even mean? And now I see everything through a performance psychology lens.
Sure. Yeah, that's awesome. And I think you as a mentor can serve so many people and help guide, the next generation or people who are recertifying or what have you, because and that's why, I do the mentoring as well for people who are going for the CNPC. And so like for me, at least, I don't know what your experience has been, but I just love being able to like kind of give back in a sense and just like, because we both went through it when we were going for a CNPC and with our own mentors. And so it's pretty cool to like see our mentees like doing, such great work. And just kind of see, you have a few of mine who are just going to, to teams or universities or high schools and to see them kind of like thrive, so I don't know what your experience has been, but it's pretty fulfilling for me.
Oh, same, Danny. It's one of my favorite parts of my job, actually, right? There's the excitement and enthusiasm and the curiosity and helping them kind of take that book knowledge and translate it into working with people. It's just such a cool thing.
Yeah, absolutely. And you had brought up one key aspect, which plays a significant role in what we do, at least on the performance side, and like helping our clients, especially athletes, in injury and rehabilitation, and eventually return to play. What have you seen or what have you experienced with athletes as far as the mental side of it? And like, have you seen it go from your standard, very common, it's just kind of minor anxiety about re-injury, that kind of stuff, to like maybe a more on a clinical side, kind of level to what they're experiencing?
It's a really great question, Danny, because I think that the injury rehabilitation is a time where we can see a lot of that overlap. We will have athletes that just have the normal kind of return to play anxiety and progress to rehab in a as predicted manner. They might be using mental skills to kind of augment recovery and stuff like that. But I think where we start to kind of see maybe a little bit more overlap between clinical and performance is when rehab doesn't go as planned, when there's unanticipated setbacks. I've actually worked with athletes who will like lose skills, like not be able to jump or not be able to move a limb and stuff like that because they're kind of overthinking things. And so there's definitely a performance element there. There's definitely kind of an anxiety element there. The complicated nature of the injury rehabilitation, the injury recovery. So I think that that's a really powerful way that we can be involved as practitioners because, the injury rehabilitation process, especially for the longer rehabs, they're tough. They're a grind. I do a lot of work in psychology of injury and a lot of work with athletic trainers in particular. And so being able to have not only individual interventions that are effective, but I think even group level interventions or even psychoeducational interventions. So they just kind of know like, hey, you get about halfway through rehab, rehabbing an ACL, there's probably going to be a dip in motivation, right? Like it's a 9 to 12 month recovery period or rehab period. It takes a long time, and you're starting to feel better and you want to get back on the field, the court, the ice, and you're still not fully there yet. And so that's going to bring up all those different emotions and stuff like that too. And so, the research tells us that there's a small number, more people don't have mental health symptoms during rehabilitation, but there is a number of people who do. And so I think being able to, even if we're not a licensed mental health professional, but, if we're a performance CNPC or athletic trainer, being able to identify, when somebody is experiencing some mental health concerns for referral, I think can be really, really important and powerful, because that can certainly impact the rehabilitation process.
Yeah, for sure. And either it's different factors that can definitely either increase, someone's risk of experiencing more clinical side, the side of it, because I know in my past working with different athletes, I know one big factor that has definitely impacted their perception on like how it's a lot they're allowing to affect them has been like time or like opportunities or lack thereof, where like you look at maybe like a high school senior trying to play for a scholarship, or a college athlete who is on their last year of eligibility, and they're trying to make themselves, known, or a professional athlete trying to, like, I used to work with a lot of minor league baseball players, and they're trying to earn a contract. They're trying to work their way up the ladder of to the show, right? The Major League Baseball. And so like, I feel like, especially when you have someone, and it's a common thing that we see in performance, of how like they so often it's like in their minds, it's a simple equation of like harder work equal or more equals better, right? Especially, and that includes like during rehab, right? And so because obviously like us as athletes and athletes in general, we're so competitive, and that includes like rehab. Like, most of us are like just itching to get back, and sometimes we go back a little earlier than we should, right?
Totally.
Like, talk to me about like your perspective on that, and like have you dealt with that before or seen that?
Yeah. Oh, absolutely, Danny. No, I think that you're really talking about some really important components around, that what does that injury mean for them, not only personally, but professionally? That's a real, and then that gets into the athlete identity component, right? Like how salient do they, or how much do they view themselves as that athlete role? And sports by their very nature are imbalanced, right? So if you're, wanting to get that college scholarship, or if you're that collegiate athlete that wants to play professionally, and you're that professional athlete who wants to continue their career, like the more elite you become, probably the more imbalanced things are, because you're investing more and more time in your sport. And so I think that there's that grappling when athletes are injured with like, who am I? What's my role? What does this mean for me? And I think that that's part of what can be so hard about rehabilitation, is they might not know. Or, like you're talking about, Danny, like athletes, so often with elite athletes, instead of helping them put the gas on, I'm like encouraging them to like put their foot off the gas a little bit.
Yeah, to put those little wooden blocks in front of them so they can't go anywhere. Yeah,
For real. Like they're such a motivated group of humans.
yeah,
And so, and that, I love that what you're talking about, Danny, that concept of like, more doesn't always mean better when we're talking about rehabilitation, or even emotions or mental health, right? Like doing it harder, faster, stronger. Like that's sometimes what the problem is, right? Like, we're injured, or maybe that, trying to push through emotion or just bury those emotions, that might actually contribute to mental health difficulties. And so I think it's just helping athletes kind of recognize that, and also sit with some discomfort around that, right? Like they're athletes that are used to doing and grow and making things happen. And so really one of the things I often talk with athletes about is that patience is a skill. Learning how to build that skill of patience. And almost always they laugh at me and roll their eyes. They're like, I don't want to build. I was like, well, we cannot. You have that choice.
yeah.
And it's a really, really powerful skill for athletes, I think, especially during the rehabilitation process.
Oh yeah, for sure. And yeah, patience and I'm included in this too, because I remember when I
Same.
was there playing football or baseball, basketball, whatever it was,
Mhm.
I got hurt often. So I remember just, my coaches, oh, maybe not so much my coaches, but because, I had the old school coaches, like if you could walk, you're out there, you're playing, right?
Yeah.
So,
No, totally. Yep.
so like, and that plays a factor too of like
Mhm.
people pushing you. And
Yep.
obviously in today's day and age, we're more
Mhm.
aware of, physical and even like concussions, right? Like
Yep.
when I was growing up, that wasn't a thing. I mean,
Yep.
we called
Totally.
it getting our bell rung
There
and
you
get
go.
back out there. If you're standing, I remember my coach
Mhm.
literally, like, when I was playing football, took me out of the game and he shined a light in my eyes, and he's like, all right,
Yep.
get back out there, Pueblo. So you're good. And I'm
Right.
like, you don't see that today, or at least you shouldn't, right? Because
Right.
we're a
Right.
player. Um,
Yeah.
that just goes into like this pressure of like having to
Yeah.
be out there, right? And I remember like
Yeah.
this, you felt like guilty of like, oh, I should be out there with my teammates.
Absolutely.
And then you couple that with any other pressures, either from, again, time situation or
Yeah.
family or parents
Yeah.
or coaches, teammates, right?
Yeah.
It just plays such a significant role. And I know one of the biggest
Mhm.
like challenges that I face that you kind of alluded to is
Mhm.
having these athletes slow down
Yeah.
and recognize that recovery is just as important as training,
Mhm.
right?
Mhm.
Because we break down our bodies and muscles. And this is why I talk and emphasize the importance of sleep, the importance of
Mhm.
nutrition, hydration, all this
Yep.
stuff, and taking care of your bodies, because that's
Yep.
just, I tell you, your bodies are machines. You have to take care of
Yep.
machines. And
Yep.
you can't keep a car running just all day and all night. You have to let it relax and rest, and
Right.
it'll be good to go, right? So,
Yeah.
but just that competitive nature, and I
Yeah.
think a long way as far as like, and obviously the research
Yeah.
has definitely helped, but to be more aware of, and
Yeah.
now you're seeing more and more athletes.
Yeah.
It starts up top, right? Because you
Yeah.
see the athletes, the younger ones, they follow what they do. They follow
Yep.
what
Yep.
the big stars, and and the professional
Mhm.
they do what they do.
Yeah, exactly. Well, and I think that that's why, whether we're talking about mental health or how we approach injury rehab or how we approach recovery, I think the more and more examples that we see, in professional sport, elite sport, collegiate sport, yeah, of people identifying that and taking care of those factors, and really, like, I love that what you're saying, actually, Danny. The idea of like rest and recovery, that's performance, right? Like that, it's not just going at 100% all the time. And also learning to rest and recover, that's also a trained skill. Like, so I'm a triathlete and I have a lot of friends who are triathletes. They are not a group of humans who like to rest or to taper at all.
Yeah,
And so I think kind of just even working around around being more flexible about kind of how we think about sports, and sports evolve and change and shift and grow. And, since I've been in sports, I've seen shifts in that way. We still have a long way to go. And I also think, we're having some really important dialogues on very public levels about the importance of these things, which is fantastic.
sure. Yeah, I mean, we could go on and on about all the
Right.
different issue, and that's the thing too, is like, we have the opportunity because we both have been in the
Mhm.
shoes of these
Yeah.
athletes. I
Yeah.
mean, and that definitely has helped me just being able
Yeah.
to empathize and say, hey, like maybe
Yeah.
our experiences weren't exactly the same, but I'm like, yeah, I
Mhm.
remember, having pressures from parents or coaches and all that stuff. And
Mhm. Yeah.
I think that just definitely, and like I think it gives us an appreciation
Yeah.
for this kind of stuff, right?
Mhm.
And even like we talked about the elite athletes and being a good role models for like physical performance, recovery, all that stuff, but
Yeah.
even the mental side, right? They
Yeah.
just talk about mental health, talking about their challenges, opening up,
Yeah.
making themselves
Yeah.
vulnerable to the general population, and
Yeah.
even the utilizing a mental performance coach, right? I mean, you're seeing more and more of
Right.
that. So, I
Yeah.
mean, like, what have you seen on your end as far as like that goes, and how
Mhm.
impactful it's been, like, not only for like that level, but even the ones in the lower levels.
So I've been kind of in the sport world, give or take, since about 2000, or on the professional side, or being a mental health professional, since about 2007. And there have been huge shifts since I started as a psychologist, actually, especially within the last 5 or 10 years. I think I'm also the director of mental health and performance psychology for a Division I institution. And every year we just see more and more athletes who are more comfortable reaching out, or, grabbing me on the sidelines or saying, hey, can I come talk to you? Or, hey, I have a question. And I think the more that we can kind of embed professionals into these spaces, just like a strength and conditioning coach, just like another position coach, just like an athletic trainer, I think the more we're just another member of the team, which I think is so important. And I think historically, especially from the mental health perspective, and maybe a little bit from the performance psychology perspective, we've just always been so separate. And so there's like, oh, you're going to go to that person, which still has its merits. But I think being embedded in teams is actually really, really important, because then we're just another member of the staff who's helping them from a psychological, performance psychology or mental health perspective angle, which I think is really, really powerful. And just it just normalizes that. We call it stigma reduction, going to practices and being in spaces for athletes. It's stigma reduction.
Absolutely. And, I had like one of my guests on the show, one of my good friends, Martin, he's one of the mental coaches for the Cleveland Guardians baseball organization. And we talked about that. We talked about how like, he's just, like how you are with your program, like he just, be out there with the guys and, he doesn't like to be in the office, because some guys, they might be afraid of that setting, right? They'd rather be in their own element. And that makes it more comfortable, right? And if you want to go back in the office, we to go back in the office and chat, right? But I feel, and that's why when you have these up and coming young athletes who are going into these university programs or professional organizations, and they see like, oh, there's a mental coach, and my teammates are using them, and they're like another coach. It's like it just goes right into it instead of like, oh, like they're bringing someone in now, right? So I think like if it's already embedded into the culture, into the team, I think that makes it so much easier. It's and that's why I've been telling people for years since I've been in the field is like, we want it to be, and it should be as normal as having a nutritionist or a strength and conditioning coach. Like we're just your mental coach. That's it. That's why most of my clients call me coach. Like I'm just another one of your coaches.
Totally.
Trying to like break down that wall, that barrier that they're coming in with, trying to see if they can trust me and. Because there is still, there's that stigma when you hear psychology or hear this stuff, and they say, oh, nothing's wrong with me. Well, nothing doesn't happen. If you have something wrong with you, I'll help you out, right? But it doesn't always have to be that. Like I can only work with you if you have challenges,
Right. Absolutely. No, I love that perspective. Right. And like you said, like, sometimes there are issues and challenges, and that's what we help with, which is cool. And that's not what it has to be. And so I think having even more flexibility around what that looks like and what that means. I love like prevention models or like educational models and things like that. I love like treatment models as well, but like there's so many things that we can do from like a group perspective, a team perspective, a systems perspective that can be really helpful for the athletes that we serve.
Sure. Yeah. And you're at the university level, correct? And
correct.
And one thing, because I have a lot of people who just reach out to me, I'm sure you do too, and just ask me like just career advice or just this, whether it's mentees or just random persons emailing, and one thing I tell them is like, what I've seen, I don't know if what you've seen from your end, but I've seen a lot of like career opportunity, job opportunities, especially at the university level, where they are looking for people who have their, their background in the clinical and performance side, where I see a little bit in like with professional teams. Sometimes you have, job postings where it's just performance psychology, just having the CNPC, for instance, right? But from your perspective, what have you seen, and like what's been your experience as someone who is working, at the university level, and has a background in both clinical and performance?
My perspective is actually, or my experience is very similar to your, Danny, that the job openings are typically a combination of being a licensed mental health professional and having some performance psychology training or being a CNPC at the collegiate level. I think you're right that there is becoming more performance coach only or CNPCs only But predominantly it's the licensed mental health professionals with that training at that space that the jobs are being advertised for. In some ways, what I always tell students, because I too get a lot of requests and like things like that from people who are interested in the field. And I think the thing that I always tell people is, if you're not sure what path you want to go or what kind of training you want to get both, right? Like there's no harm in getting training in both. If you know you don't want to treat mental health difficulties, don't go that route, right? Like
Yeah.
if you know you just want to do performance psych, then do that route. But I think that personally for me, I think that there's a lot of value in being trained in both, because I kind of know how to tease those apart. And I might not be the person who provides that mental health treatment, depending on the severity of the mental health concern, just on the nature of my schedule. I might refer to one of my colleagues who's able to kind of provide more mental health treatment for that athlete, and I'll work predominantly on performance psychology. But I really do personally value the ability to be able to kind of have those conversations and the nuance around those conversations, to talk with athletes about, hey, here's something I think that might be going on, and here's what I would recommend in terms of treatment or the next direction for that. I think with collegiate athletes, I love working with that population, and there's a lot going on. We know that 75% of mental health concerns begin prior to the age of 24. So chances are, if somebody's going to have the onset of a mental health concern, it's going to be in college or in that college age population. I think being able to, at the very least, identify and refer, even if you're not somebody who's trained to treat those things, I think having those skills to identify and refer athletes experiencing mental health concerns is actually really important.
Yeah. And just like I said, being able to identify that, and whether or not they want the expectation on you is to provide these clinical, therapies, or just performance, at least okay, like this person might need a little bit more, maybe a little bit different attention on the clinical side. Then just like I do, like I don't have a clinical background, but I'm able to see, okay, like they might need a little bit more attention, or from someone else. Let me give you a warm handoff to my colleague. I'll refer you to someone.
Yeah.
And there you go. And that's what I tell people, is like, it doesn't make you less of a practitioner, because I've been referred to, from someone who is strictly clinical, and they're like, hey, I have someone who's dealing with some performance, it's like psychology issues. I think you can help them. So, it's just, we're all trying to help. At the end of the day, we're all trying to help the person, right? The individual.
Absolutely. Well, and I think I come from such a strong teamwork perspective. Like I've always worked in interdisciplinary settings, whether it's with psychiatry, family med, sports med, athletic training, CMPCs, other mental health professionals. And so I think, being able to just recognize what we're able to do and what we're not able to do. Like, even though I'm a licensed mental health professional, like I don't have primary substance use disorder training. So if somebody has a substance use concern, I'm not competent to provide that assistance. And so I think being able to recognize that and say, I'm not the best person for you, and I want to connect you to people who can help. And unfortunately, based on my training and my skill set, I'm actually not the right person for that. And, like you said, warm handoff, I know so-and-so, and, I'd recommend you meeting with them. And so I think, when we work with humans, that's just such an important skill set, to just be able to know our areas of competency, and then also, be able to say, I'm not the best person for that, and I know someone who is.
Sure. And that kind of like dabbles into the ethics of it, right? Because
Absolutely.
You might have, sometimes there's a very thin line, where you might have someone that, might know has a book smarts for certain things, but they shouldn't be working on certain challenges that the client might be going through. But they might say, hey, you know what, I could do it, let me help you out, right? And I remember there were times where it's happened a few times where I've had to refer out, but I remember I was working with this high school basketball player, and we're doing great work. And I remember just one time in a setting, he was just kind of looking around and he wasn't focusing. And I come to find out that the mom had told me that he was diagnosed with schizophrenia, and that he was hearing voices. Can you help him? I know you're backgrounds in psychology. And I was like, unfortunately, like that's out of my competency. Let me refer to someone. And if and when he's able to get that in better control, I'll be right here, right?
There you go.
So, but there, that's a very clear-cut example. But there are other times where, like I said, substance abuse, or I've had parents wanting me to do like marriage defining therapy for them. I'm just like, I appreciate you, because like their child and I are doing
Right.
great work together.
Right.
And
Right.
like, I remember I had a mom who was like, "Oh, my husband and I were going through this rough patch. I need you to help us." like, I have a colleague of mine who I know should be perfect for you. Let me refer you
Right.
to her. Um, but like one example I tell people, it's like you go to your medical physician and you ask them,
Mhm.
"Oh, I need a root canal." They're
Right.
gonna say, you probably want to go to the dentist, right? It
Totally.
doesn't make them less of a physician. It just
Right.
like everyone has different competencies,
Yep.
and that's why we have to, as practitioners, we have to
Mhm.
have the best interest for a client, know what we're
Mhm.
competent, know our skill set, know what we're
Yeah.
certified or licensed in, and
Yeah.
know what we're not. And again,
Yeah.
it is a teamwork aspect to it because at the end of
Yeah.
the day, we get to it comes down to the client's well-being, right?
Yeah. But I think that that's actually, as somebody who's kind of dually trained too, right? Like that's always something that I'm trying to be clear about. Like,
Mm.
sometimes I'll be hired, or like the role that I serve with that team is performance, and it's performance only. Even though I'm a licensed mental health professional, because I'm working with a team in a performance realm, I'm not going to be the best person to provide mental health treatment for somebody. And so, I think when you said ethics, like, oof, I love ethics. Like, I'm an ethics nerd. I do a lot of ethics CEs. I do a lot of presenting about ethics. And because I think it's just such a, having those discussions. And I think it's just, it's empowering, and it helps our clients, right? Because ethics are designed to ideally keep everyone safe and not muddy the waters. And ethics are muddy, right? Like we don't always have clear cut answers. And that's, when I'm working with trainees and graduate students and stuff like that, they're always like, well, what do I do? And I'm like, well, let's kind of work through that ethical decision making model. And things aren't always clear cut. But I think the more that we can kind of think about our skill sets and the potential challenges of different things and working in different environments, ahead of time, it's not a foolproof mechanism, but I think that that's also probably the nerd in me, and thinking about like, ooh, how can I navigate those ethical dilemmas in a meaningful way?
Mm.
But I think if we always just go back to, doing right by the client, that's always when we can center that. I think that that's really powerful.
Yeah, I love it. I love it. So looking back on your career throughout your whole journey,
Mhm.
I know we all have our stories of like things that just stood out and just kind of reinforce our desire and love and passion to do what we do.
Yeah.
What have been some of those for you?
Oh man, there's so many, Danny.
I
That's so
know.
hard to
Yeah.
pick, right? I'm like, oh man. It's funny because I mean, I literally am like flooded with so many ideas that I can't necessarily pick one. But I think a theme that I always come back to is just working with an athlete and something that they're maybe stuck with, or something just like resonates with them in a different way. And they're like, wait a minute. And I'm like, oh, there it is. There it is. Like I get goosebumps even thinking about it. Like
You can see
just
the light bulb just go, right?
totally. I love it. Like just understanding of themselves in a
Yeah.
different way. That's really empowering. I think that that's the, whether we're talking about mental health, whether we're talking about performance, like it's just such a cool aspect of what we do. Because then that's knowledge that they're empowered with, that they can use to be the best version of themselves. And I'm always purposely vague when I say that, because everybody has different things that they're going for. Everybody has different things that are important to them. And, really what I hope for athletes that I work with and serve is that they're able to live their life, whether it's an athlete, as a person, as a friend, as a family member, as a partner, in ways that are just full of meaning and purpose. And, when I'm able to do that, or be a part of that for athletes, whether it's, winning national championships, whether it's learning about themselves, whether it's getting a pro contract, whether it's retiring for mental health reasons. I feel really honored to be able to share that space, which is, I recognize, very vague, but I have to, because there's so many examples that come to my mind that will be here like for 5 days.
Oh yeah, yeah. No, I love it, and yeah, I mean, I'm gonna say, as you're going through that, I'm thinking of my own like just stories, and I'm like, yeah, that's pretty awesome, and
Yeah.
that's what makes it fulfilling, right?
Right.
That's all that education, all the money, all that stuff we
Yep.
invested in time, that we invest into our
Yep.
education and career. like all that stuff, like this stuff is what makes it all worthwhile, right? Knowing that we made a
Yeah,
difference, and at least a small part, right? Like that's what I tell my
exactly.
clients, like you guys are the ones that have to do the work and do.
Correct.
I'm just here to help guide you or help you in any way. I'm in your corner, right? Like I'm
Yeah,
just another, like it's a
yeah,
coach, right?
yeah.
But it's like seeing that it's almost like your own little, like a niece or nephew or child or whomever.
Yes.
And you're like, yeah, it's awesome, right? Rock on. So I love the
Yeah,
fact that you have many experiences, and because there are people out there who
mhm,
are just starting now to get their feet wet in the field, right? And
right.
because especially like performance psychology is still in the
Hmm.
grand scheme of things in its infancy, right? Compared to other
Right.
like disciplines of psychology, although it's been around more and more longer than people realize.
Hmm.
Um, so like when you do have these people, because I know we both have people coming up to us and just picking our brains as far as the career, what should I do?
Yeah.
Like if you have people who come up to you, or when you do,
Mhm.
what is some like advice, or if anyone's listening right now who might want to work in the field, like what would you tell them?
I actually think, one of the most helpful, well, there's two things that kind of jump out in my mind. And it's kind of related to what we had just talked about, Danny. But the first thing is remembering it's not about me. It's about the athletes that I serve. And
Mm,
am I part of their journey? Absolutely. And I'm so honored to be a part of their journey. It's not mine though, it's theirs. And so I think sometimes with performance and sport, it can be really like captivating and like, oh, I have this athlete doing this. And like, I don't even use the word my athlete. Like, I don't own them. Like,
mhm.
it's always just a kind of a phrase like in students, like they're not my students. I don't own these students. Like, I always think
Yeah.
about it like I work in service with them. And so I think that that's always an important thing to remember. The other thing that I think is really important too, and it just depends on, kind of how people come into the field of performance psychology. Um, but I think another part that's kind of along the same lines is relationships are just simply so important. Connecting with people, really understanding them and their world, um, understanding the worlds of coaches and administrators and systems. I think the more kind of systems based that we can approach things, and just kind of the more that we can just be curious. I work with some people that are entering the field that maybe don't have a huge sport background, but they're super curious about people and they're super curious about things. And I think we just can't go wrong when we're curious and are just wanting to understand more and understand why. And um, so I think kind of, remembering why we're there, building relationships and just be curious and, learn as much as you can about different things. You're not going to know everything. You're not supposed to, which that goes back to competency, right? Like there's just some things that I'm not competent in and that's not my lane. But I think having that disposition throughout your journey and your education, I think can just be so, so powerful. And you'll find the stuff that speaks to you. You'll find the stuff that's meaningful. And I think building those relationships too, right? Like when we build good relationships with people, things will come our way. There's, when I first kind of got into the field, it's funny. And when I work with people kind of getting into the field, there's kind of this initial like, okay, I'll put myself out there and then like clients will just come. It's like, well, they
Have
will
fun with that. Good
eventually.
luck.
And there's like, well, I have this website and they haven't got like, what's going on? I'm like, hold on, like patience, right? Like put yourself out there, get to know people, ask questions, be curious, be mindful, of like what's going on for other people. Think about ways you can, learn and serve and that kind of stuff. Stuff will come around, right? Like my entire sports psychology career is just built on forming really great relationships with really athletic trainers in particular, but other people in the field and physicians and sport administrators and stuff like that. And I think kind of also goes along the lines of patience, right? Like typically people who go into the sports psychology realm, we're probably in the athlete group and we're probably not terribly patient. But sticking with it, just like with sports and performance, it'll come.
Yeah. A lot of great advice. I'm sure you've given plenty more to many people around. And yeah, but it's true, and I can't emphasize that, like the networking and building relationships part enough. And I've said it many times, with different guests on the show, because I had so many people come on here basically telling the same thing as far as,
Right.
and I've had different people from different industries
Yeah.
come on the show.
Yeah.
And that's what it comes down to, right? I mean, and I've talked to people even in the performance psychology side, and asking them, like, how did you get your position? How did you get that opportunity?
Yeah.
And more times than not, at least from what I've heard, they're like, it basically came down to right place, right time,
Yep.
or just talking to people. But like, yeah, there's a certain aspect of luck, but you have to make your own luck. You have to create your own luck and put yourself in these positions for things to happen, right? Like, you have to be talking to people. That's why, like, with my mentees, I go over this whole training on LinkedIn, like just how to use it and implement it. It's such a powerful networking tool. Like, just you and I, we just started following each other on social media, and here we are, like just kind of like cheering each other on. And I see what you're doing. I'm like, yeah, Erin, so
Same, Danny, same. No, but really, like, I live in North Dakota, right? Like,
yeah.
There's not many. Well, I think I'm the only. There's two people I think that are licensed psychologists who are CMPCs that are licensed in North Dakota, but they're not actually in North Dakota. I'm actually the only one physically located in North Dakota. Like, so I know a lot of my colleagues I've met virtually, right? Like, and it's scary, right? Putting yourself out there and like connecting with people can be scary. But that's how you find your people.
Yeah, just talking to people. I mean, I've had mentees and who just, they're doing informational interviews and talking to people, picking their brains, and all of a sudden they're like, they call them back. Hey, I remember, we were talking and you're looking to get into the field. Like, are you still interested? And we have an opening, right?
Right.
That's how this stuff works. It's like, you can't just sit on your hands and expect things to happen. Right. And that's across the board in any industry. Right. But I think, like, that's where, like, just building relationships, networking, even for people who are in sport performance psychology, they have like the annual conference, Ask Conference. Are you going to that, by the way?
I am actually presenting 3 times. That's
awesome. Okay, I'll be there. So
we're gonna meet in person, Danny.
I'll be in person. I'll be in person. We're gonna meet in person. That's awesome.
Awesome, cool.
Yeah, so I'll be making my way to Texas for the first time ever. So I'm excited about that.
Cool.
Yeah. So I'll definitely have to figure out when you're presenting, and I'll be there.
Yeah, that'll be awesome, Danny. Love to have you.
Yeah. It's like attending those things, or like the smaller regional conferences, or just there's so many examples of this stuff, and that's where the magic happens. That's you have to kind of create these situations to come up, and having that patience, right, and not being afraid. And like, one thing I learned, even when I used to work in the sports business, is like, you can't be afraid of the no. You can't be afraid of rejection. And I've had people, I tell them, like, hey, reach out to people, and you're gonna get a bunch of either no responses or no's, but it just takes that one that says yes, or 2 that say yes, and that's all it takes. Right. And that's all, like, people who are really good in sales, and they know that. It's like, hey, I'm gonna get a ton of no's, but it just takes that one yes. Right. And we have to, like, especially people early on in their careers and who are trying to get exposure, get experience, and they have to kind of break through, because it's scary. Yeah, it is scary, especially you're early, first time practitioner, newly graduated, newly CMPC, right? And you're like, oh, like, now it's like the real life is hitting you. You're like, I have to go on and talk to people, right? But it just, over time, you just become, again, you just building relationships and talking, and that's where the beauty happens.
Absolutely, Danny. No, I totally agree. And like we've talked about, it's scary. And and I think it's also important to remember that those no's or those non-responses, they're not personal, right? Like, it feels personal. And that doesn't mean, like, you don't say, wow, that hurts, and that gosh, that's frustrating or disappointing. And it's never personal. People are just living their life, doing their thing, and like, and it's just like getting difficult feedback in sports, or getting a bad grade, or a grade that we don't want on a test. Like, it sucks, and and we keep going.
It's like they look at your email or LinkedIn message or whatever, and say, oh, you look like a horrible person, I don't want to talk. No, it's just people, they just have other things or whatever, so
who knows, right? We never know. We never know what's going on in people's lives.
Exactly. So Erin, I definitely appreciate the time that you took today. I know we can go on and on forever.
We could, Danny. We could talk for hours.
Yeah, but I know anyone who's watching this, listening in, is definitely is getting a lot of value from what you brought today. So thank you so much for being on here today.
Yeah, thank you, Jenny. I truly appreciate you, and I appreciate the space you've created. Look forward to actually meeting in person. That will be awesome.
Yeah, I mean, from California to you said North Dakota.
North Dakota,
North
correct?
Dakota, yeah.
Yes.
I've never been there, but maybe one day I'll make a trip. So
Fair enough. Most people have not been to North Dakota, to be honest, so it's all good.
yeah, most people know where Disneyland is, so it's not too far from me. So
There you go, Jenny. There you go.
so Erin, if anyone wanted to get in contact with you or to follow you, like what's the best way they can do that?
So I have a couple of different ways. So I have my own personal social media is at Dr. Erin Haugen. And then my own personal webpage is drerinhaugen.com. And then I also have a performance consulting business, which is Haugen Performance. So at Haugen Performance or Haugen Performance. Oh, no, it's at Haugen Perform, because social media handles have to be shorter.
Yeah.
And then my website is haugenperformance.com. So I'm decently active on social media. There's different ways to contact me on my website. Those are probably the best ways to kind of follow me. Instagram, Facebook, Twitter. That's about as sophisticated as I can be with social media. I'm purposely staying off TikTok because I'll watch too many dog videos. So, but yeah, no, I'm happy to connect with people on social media.
I love it. I love it. Yeah. Follow Dr. Haugen here. And she puts a lot of great content, and she's not even close to being done. She has so much to do, for people around. So I'm excited for what you do, Erin. So thank you again. If you're watching, if you like what you see, we're going to have more great guests such as Dr. Haugen here. Follow, subscribe, tell your friends. Again, thank you to our guest, Dr. Erin Haugen. It's been a pleasure talking to you, and I'm looking forward to seeing you in Texas in a couple of months here.
That sounds fantastic, Jenny. Have an awesome day.
All right. Thank you, guys. Thank you, everyone, for watching. Take care of yourselves and each other. We'll see you on the next one. Bye-bye.